Hello and welcome to Math Simplified. I hope all of you are doing well. In this video, we will discuss about gastroesophageal reflux disease, also known as acid reflux disease or heartburn. Gastroesophageal reflux disease happens when contents from your stomach move up into your esophagus. It is also known as acid regurgitation or gastroesophageal reflux. Now, at the entrance to your stomach is a valve, which is basically a ring of muscles called the lower esophageal sphincter or LES. Normally, the LES closes as soon as food passes through it. If the LES doesn't close all the way, or if it opens too often, acid produced by your stomach can move up into your esophagus. This can cause symptoms such as a burning chest discomfort called heartburn. If acid reflux symptoms happen more than twice a week, you may have acid reflux disease, also known as gastroesophageal reflux disease. So now we know a little bit about what is acid reflux disease. Let's look at the three main factors that lead to acid reflux disease, which are poor or slow clearance of food from the stomach, delayed stomach emptying, and too much acid in stomach. Slow clearance of food from the stomach can be caused by various reasons like eating very large meals or lying down after eating a meal, being overweight or obese, eating a heavy meal and then lying on your back or bending over at the waist, snacking close to bedtime. All these habits lead to retention of food in your stomach for longer periods of time, and then there are more chances of the acidic contents of your stomach to regurgitate into your esophagus. Delayed stomach emptying is also known as gastroparesis, and one of the most common causes that lead to delayed stomach emptying is diabetes. It can also be caused due to pregnancy, as a uterus can push up against the bowel and stomach, leading to a partial mechanical obstruction. Other causes include a lack of thyroid hormone, also known as hypothyroidism, viral infections of the stomach, or medications like narcotics and antidepressants, and it can also happen in diseases like Parkinson's disease and multiple sclerosis. The third main factor that leads to acid reflux disease is more common than the previous two, and that is the excessive production of acid in your stomach. Some of the most common causes that lead to excessive production of acid in your stomach are eating certain foods such as spicy or fatty foods, chocolates, garlic, onions, and citrus fruits, drinking certain beverages like alcohol, carbonated drinks, coffee, and tea. Smoking is also one of the most common causes of hypersecretion of acid in the stomach. Many medicines can lead to excessive acid secretions, and these include pain medicines like non-steroidal anti-inflammatory drugs, which include ibuprofen, diclofenac, aceclofenac, etc. Aspirin, some blood pressure medications like nifedipine, iron supplements, and bisphosphonates can also lead to excessive production of acid in your stomach. Excessive levels of stress and people with type A personalities can also develop excessive acid in their stomach. So these were the three main factors which can lead to gastroesophageal reflux disease, which is poor clearance of acid or food from the stomach, which can be due to eating large meals at once or lying down early after eating meals. Obesity is also an important reason for this. Delayed gastric emptying, which is also known as gastroparesis, can be due to diabetes, pregnancy, hypothyroidism, and many other factors. The last and the most important factor, which is the hypersecretion or excessive secretion of acid from your stomach, which is due to eating wrong types of foods and beverages, taking too much stress, smoking, and certain medications. Other than these, some structural defects can also lead to acid reflux disease, and one of the most common cause of them is hiatal hernia. The diaphragm is a muscle that separates your stomach from your chest. Normally, there is a hole or hiatus in the diaphragm through which the esophagus passes and connects to the stomach. If this hole or hiatus enlarges, the upper part of your stomach can partially move through the abdomen into your chest, which increases acid reflux. Weak muscles in the diaphragm can allow the stomach to move freely into the hiatus, or inherited structural abnormalities in the diaphragm can cause a congenital hiatal hernia, which usually presents at birth. Other causes include excess pressure on the abdomen or muscle strain due to heavy coughing, constipation, or intense physical exertion. Pregnancy and obesity are also a risk factor for hiatal hernia. So these were some of the causes of acid reflux disease. Now let's look at some of the symptoms with which this condition can present. One of the most common symptoms of acid reflux disease is heartburn, which is a burning pain or discomfort that moves from your stomach to your abdomen or chest, or even up into your throat. You can also experience frequent regurgitations of food or liquid into your mouth, which leaves a very sour taste on the tongue. If you are having acid reflux disease for a very long duration, you may experience difficulty in swallowing the food and a feeling of lump in your throat. A constant dull pain in your stomach or chest or shortness of breath can also be the presenting symptoms. Chronic acid reflux can lead to erosions in your stomach or esophagus, which can bleed over time. This blood is passed in your stools, which appears blackish. Blood in vomiting can also indicate bleeding in your esophagus or stomach, which usually presents as fresh blood clots. Other symptoms of acid reflux disease include hiccups that don't let up, nausea, weight loss for no reason, wheezing, dry cough, hoarseness, or chronic sore throat. Now let's talk about how is acid reflux disease diagnosed. You should see your doctor if you have acid reflux symptoms 2 or more times a week, or if medications don't bring lasting relief. Symptoms such as heartburn, sour eructations in the mouth, abdominal pain, and hoarseness of voice are key symptoms to diagnose acid reflux disease, and most cases of acid reflux disease are diagnosed with clinical symptoms only. If your problem persists for a longer duration of time, or if you are not having a relief with typical medicines, your doctor may perform certain invasive tests to confirm the diagnosis of gastroesophageal reflux disease. These include X-rays of your upper digestive system. X-rays are taken after you drink a chalky liquid that coats and fills the inside lining of your digestive tract. This liquid, which usually contains barium, allows to visualize a silhouette of your esophagus, stomach, and upper intestines. Upper GI endoscopy is also done, and in this test, a thin, flexible tube which is equipped with a light and a camera is inserted down your throat to examine the inside of your esophagus and stomach. Endoscopy can detect inflammation of esophagus, hiatal hernia, strictures, ulcers, and other complications. Another test that can be used to diagnose gastroesophageal reflux disease is the ambulatory acid pH probe test. In this test, a monitor is placed in your esophagus to identify how frequently the acid from your stomach regurgitates up into your esophagus. The monitor is connected to a small carry-based computer that you can wear around your waist. Esophageal manometry measures the rhythm of muscle contractions in your esophagus, and that is done when you swallow. It also measures the coordination and force exerted by the muscles of your esophagus. So now we have talked about what is acid reflux disease, how it presents, and how it is diagnosed. Now let's jump over to the treatment part of the acid reflux disease. Although there is a plethora of over-the-counter medications that are available in the market to treat acid reflux disease, the first thing you should try before medical treatment is dietary and lifestyle modifications. While diet does not cause gastroesophageal reflux disease, it can certainly aggravate or increase the reflux of acid into your esophagus, causing heartburn. Certain foods compromise the lower esophageal sphincter's ability to prevent reflux and are best avoided. This may differ person to person, but it is usually noted that foods like spicy, fried, and fatty foods, onions, tomatoes, chocolates, beverages like tea, coffee, and alcohol cause the most trouble. So it is best to completely avoid these types of foods. Certain types of foods are very helpful to reduce the symptoms of acid reflux disease. These foods include curd and yogurt, ginger, oats, green leafy vegetables like spinach and celery, fruits like watermelon, pineapple, and papaya. So try to include these foods more often in your diet. In the end of the video, I will share 2 wonderful and effective home remedies for acid reflux disease. So make sure to watch this video till the end, and if you want to know more about diet related to acid reflux disease, click the link in the I button above to know about the best and the worst foods that you can eat for people with acid reflux disease. Also make sure to subscribe and hit the bell icon if you want to be notified about our upcoming health and fitness videos in the future. Now there are lots of lifestyle changes that you can do that will help you to avoid acid reflux. Don't go to bed with a full stomach. Eat meals at least 2 to 3 hours before lying down. This will give food the time to digest and get out of your stomach. Don't overeat. Eat smaller portions at meal times or try to eat 4 to 5 small meals instead of 3 big ones. Raise the head end of your bed by placing wood or cement blocks under the feet of your bed so that the head end is raised by 6 to 9 inches. This ensures that the acid doesn't reflux easily into your esophagus while you are sleeping. Maintain a healthy weight. Excess weight, especially due to abdominal obesity, can put pressure on your abdomen, pushing up your stomach and causing acid reflux. Avoid tight-fitting clothes. Clothes that fit tightly around your waist put pressure on your abdomen and the lower esophageal sphincter. Stop smoking. Smoking decreases the lower esophageal sphincter's ability to function properly and also leads to excessive secretion of acid in your stomach. So these were some lifestyle and dietary modifications that you can do to prevent and decrease the symptoms of acid reflux disease. Now let's look at the medical treatment of acid reflux disease, and before we begin, it's my duty to inform you that I cannot prescribe all these medications on YouTube video, and the content of this video are just to educate you all. Many of these drugs are available over the counter, meaning you can buy them without a prescription. However, it is important to see your doctor if you are having these symptoms for a longer duration of time. Well, with that said, let's look at what different types of medicines are given in acid reflux disease. Number 1 are the antacids, which are the most common drugs used for acid reflux disease. As the name indicates, these are antacids, which means they contain basic chemicals that neutralize the acid present in your stomach so that there is no acid to reflux. The problem with antacids is that their action is very short-lived. They are emptied from the empty stomach quickly, in less than an hour, and the acid then reaccumulates. The best way to take antacids therefore is approximately 1 hour after the meal, which is just before the symptoms of reflux begin after a meal. Since the food from meals slows the emptying from the stomach, an antacid taken after a meal stays in the stomach for longer and is more effective. Antacids are usually made of aluminium, magnesium, or calcium. After the antacids, the next class of drugs that are used in the acid reflux disease are known as H2 blockers. You see, there are H2 receptors in the cells of the wall of our stomach. When these H2 receptors are stimulated by histamine, it leads to release of acid in the stomach. So drugs were developed to block these H2 receptors. These drugs include cimetidine, ranitidine, nizatidine, and famotidine. All 4 are available over the counter without the need for a prescription. However, over-the-counter dosages are lower than those available by prescription. As histamine is particularly important for the stimulation of acid after meals, H2 antagonists are best taken 30 minutes before the meal. The reason for this timing is so that the H2 blocker will be at the peak level in the body after the meal, when the stomach is actively producing acid. H2 blockers can also be taken at bedtime to suppress the nighttime production of acid. The third type of drugs developed specifically for acid-related diseases were proton pump inhibitors, also known as PPIs, specifically omeprazole. A PPI also blocks the secretion of acid into the stomach. The advantage of PPI over an H2 blocker is that the PPI shuts off acid production completely and for a longer period of time. Not only the PPI is good for treating the symptoms of heartburn, but it is also good for protecting the esophagus from acid so that the esophageal inflammation can heal. PPIs are used when H2 blockers do not relieve the symptoms adequately or when complications of acid reflux disease start to occur. Other than omeprazole, lansoprazole, rabeprazole, pantoprazole, and esomeprazole are other PPIs that are available for the treatment of gastroesophageal reflux. PPIs are best taken 30 minutes to 1 hour before the meals. The reason for this timing is that the PPIs work best when the stomach is most active producing acid, which occurs after the meals. If PPI is taken before the meals, it is at the peak level in your blood after the meal when the acid is being made. The next category of drugs used for acid reflux disease are the pro-motility drugs, which work by stimulating the muscles of the gastrointestinal tract, including the esophagus and stomach. One pro-motility drug, metoclopramide, is approved for the treatment of acid reflux disease. Pro-motility drugs increase the pressure in the lower esophageal sphincter and strengthen the contractions of the esophagus. Both effects would be expected to reduce the reflux of acid. However, these effects on the sphincter and esophagus are small. Therefore, it is believed that primary effect of metoclopramide may be to speed up the emptying of the stomach, which also would be expected to reduce reflux. Pro-motility drugs are most effective when taken 30 minutes before meals and again at bedtime. One more category of drugs that are used for acid reflux disease are known as foam barriers. Foam barriers provide a unique form of treatment for gastroesophageal reflux disease. Foam barriers are tablets or liquids that are composed of an antacid and a foaming agent. As a tablet disintegrates and reaches the stomach, it turns into a foam that floats on the top of the liquid contents of the stomach. The foam forms a physical barrier to the reflux of the liquid. At the same time, the antacid bound to the foam neutralizes acid that comes into contact with the foam. The tablets are taken best after the meals, when the stomach is distended, and when lying down, both times when reflux is more likely to occur. There is only one foam barrier, which is a combination of aluminum hydroxide gel, magnesium trisilicate, and alginate. Links to that are in the description below. The drugs described above usually are effective in treating the symptoms and complication of acid reflux disease. Nevertheless, sometimes they are not. Sometimes the amount or number of drugs that are required for satisfactory treatment are so great that the drug treatment is unreasonable. In such situations, surgery can also be done to effectively stop the acid reflux. The surgical procedure that is done to prevent reflux is technically known as fundoplication, also known as anti-reflux surgery. During the fundoplication surgery, the part of stomach that is closest to the entry of the esophagus, also known as fundus of the stomach, it is gathered, wrapped, and sutured around the lower end of the esophagus or the lower esophageal sphincter. The gathering and suturing of one tissue to another is known as plication. This procedure increases the pressure at the lower end of the esophagus and thereby reduces the reflux of acid up into the esophagus. Also, if the patient has hiatal hernia, this can also be corrected in the same surgical procedure. Fundoplication may be done using a large incision known as a laparotomy or using a laparoscope, which requires only several small punctures in the abdomen. The advantage of the laparoscopic method is a speedy recovery and less post-operative pain. So this was about the lifestyle modifications, medical and surgical treatment of acid reflux disease. Now in the end, I would like to share with you two very effective home remedies for acid reflux disease. Number 1. Drink 2 glasses of warm water first thing in the morning before you eat anything. This is a wonderful tip and I have tried this on myself and a number of patients suffering from acid reflux. The logic behind drinking warm water first thing in the morning is that when you wake up, your stomach is completely empty, and warm water flushes the walls of your stomach and increases the blood flow in it. This increased blood flow brings in important growth factors that heal already existing erosions or minor ulcers in the stomach, and also makes the walls of stomach and esophagus healthy, which helps in regulating the acid production. Practice this tip daily and you will observe improvement in your symptom within 10 days. The number second tip is eating lots of curd. Curd is a wonder food for people suffering from acid reflux disease. Curd is a dairy product obtained from milk, and milk has a high amount of calcium that prevents buildup of acid by eliminating the excess amount, making it an efficient home remedy for acid reflux. So this was all about the acid reflux disorder and its management. In the coming videos, I am going to discuss about the best diet for acid reflux disease and other natural remedies, so make sure to subscribe and hit the bell icon to get notified. I hope you liked the video. You can support Med Simplified by clicking the join button below or becoming a member on our Patreon page. Links are in the description below. Thank you so much for watching.